Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and again, we are together to cover one amazing mind-blowing topic that is nothing but rheumatic fever. In today's segment, we're going to talk about rheumatic fever and questions associated with rheumatic fever. In the evening 5:30 session, we had covered the first half of the rheumatic fever and top 20 cardiology questions. If you're a newcomer, please watch my previous video in this Unacademy YouTube channel only. We have this evening 5:30. We have done a session on the rheumatic fever beginning part and top 20 cardiology questions. Please watch them and let's start. So in the Unacademy, most importantly, we have something known as plus subscription in the Unacademy and something known as iconic subscription in the Unacademy. In the plus subscription of the Unacademy, you get to have the access to all my live and recorded classes. We get to study from the best of the best educators all over the India. You can watch me on your iOS, on your laptop, on your mobile. This is the plus subscription. Whereas iconic subscription is concerned, you get the Unacademy platform and also the prep ladder subscription. All the dream notes, rapid revision, question bank, video lectures, clinical notes, everything you get of the prep ladder also. That is the iconic subscription. And also at the same time, first of all, I would like to stress on this amazing NEET PG quiz contest, which basically has 60 minutes, 45 MCQs, 10 lakh of rupees you're gonna get, kind of this is the scholarship prize we are giving to the participants on Jan 23 11 a.m. Jan 23rd 11 a.m. You must participate on this quiz. It's very just free, and only you get 10 lakh rupees. Only 10 lakh. Zyada nahi, only 10 lakh rupees. And most importantly, if you buy this Unacademy 12 months plan, you get a 2 months complimentary off, and you buy a 24 months plan, you get 4 months complimentary off. Okay, and most importantly, being an MBBS student, it's difficult to buy a big pack. So for that, we have this small code. If you use this cute little mind-blowing handsome code, you will get some amazing financial benefit if you buy a big pack. And also, we have already made a batch on Focus FMG 2022 and Target NEET PG 2022 batch. I hope you guys are a part of it. Hello Vaidehi, hello Basant, hello Osama, and hello Priya. And most importantly, let's start this beautiful segment. And also at the same time, dear, we all have a free test on the Unacademy Educator curated test like 30 MCQs, ENT, ophthalmology, patho. See, most importantly, exam is coming very soon. Okay, this is January. February, March is the exam. So do as many MCQs as possible, as many MCQs as possible. And if all these tests are locked, but if you use this code, the test will get unlocked. It's totally free of cost. Go open and give the test. That's it. You should give lot of MCQs. I always stress on this part. And I think you all have already enrolled for Dr. Mona Lisa's anatomy test series, which is there on the most importantly 21st of Jan, 9 p.m. And again, just use any code, and this time that code is Dr. Anand. Unlock the test and give the test. So now the cardio part, we had covered our the acute rheumatic fever. In the first half of acute rheumatic fever, we have covered the basic etiology. We have covered the beautiful, John's criteria, revised John's criteria, I would say. And in this segment, we're gonna cover amazingly the second half of the acute rheumatic fever. I want you guys to have a little smile on your face. Just chill, relax, focus, and just listen to me. Okay. Hmm. Okay, Pancake is asking, sir, when will you take this kind of test? Yes, dear, maybe by the end of this month or the next month, first week, my test has been allotted and I will take the test that time. Okay. Hello, Staphylococcus, namaste. And before starting any amazing code, most importantly, like we had covered about the rheumatic fever that is caused by group A beta hemolytic streptococci. We also covered that the main pathology was the antigenic mimicry. We also covered that 5 to 15 is the most commonest age group, and less than 3 years and more than 30 it is very very rare. And also at the same time we understood that it is common in pancake, in the females basically with mitral valve disease, and boys aortic valve involvement is very very common. Okay. Also at the same time, clinical features, we learned something about revised Jones criteria, which has the major criteria and the minor criteria. It depends on the low risk and high risk population. Low risk means incidence less than 2.5 lakh in school going children, and rheumatic heart disease prevalence less than 1 in 1000. Okay. And most importantly, we know the criteria: carditis, polyarthritis, erythema marginatum, subcutaneous nodules, and chorea and Sydenham's chorea. Whereas carditis, arthritis, and edema marginatum are the early manifestation. These all we have covered in the first half. Okay, so I'm doing a quick revision. This all we have covered in the first half. And whereas subcutaneous nodules and chorea are the late manifestation. They are the late manifestation that you should remember. Okay, and also at the same time, let's move further. After finishing this major and minor criteria, we need to continue from there. So now we have to continue the further segment of the acute rheumatic fever. And and again, before starting any segment, I always say this amazing quote. Today's quote is, पढ़ना बंद ना करें, पढ़ना बंद ना करें, क्योंकि ज्ञान की कोई सीमा नहीं होती। पढ़ना बंद ना करें, क्योंकि ज्ञान की कोई सीमा नहीं होती। पढ़ाई एक ऐसा इन्वेस्टमेंट है जो आपको लाइफ टाइम रिटर्न देता रहेगा। वेरी 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 ब्यूटीफुल कोट। ओके, प्लीज रिमेंबर, पढ़ना बंद ना करें क्योंकि ज्ञान की कोई सीमा नहीं होती। पढ़ाई एक ऐसा इन्वेस्टमेंट है जो आपको लाइफ टाइम रिटर्न देता रहेगा। दैट इज वाई अंडरस्टैंडिंग द कंसेप्ट, दैट इज वाई स्टडिंग नॉलेज इज वेरी 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 crucial and precious. Okay, yes, exactly. So let's continue the further session. Once as we know that we have the major criteria and the minor criteria, if I am having the first episode of acute rheumatic fever, if I'm having the first episode of acute rheumatic fever, in my modified John's criteria, how many major and how many minor criteria should be positive? Anyone? Any random guesses? How many major and how many minor criteria will be positive in a case of acute rheumatic fever? Who can tell me? Is it two major, two minor, or one major, two minor, two major, one minor? Any random guesses? Pancake? Very good. So remember, it is 2 plus 1. Okay. 2 major or 1 major plus 2 minor. Okay. So remember, either there are 2 major criteria or very good, Osama Sheikh, 2 major criteria or 1 major plus 2 minor criteria. That is the for the initial episodes of acute rheumatic fever. How many components, how many criteria should be positive? Either 2 major or 1 major and 2 minor. That is the first point. If I already have, if I am already having second or third episodes of acute rheumatic fever, then what will here, what will be the criteria? Either 2 major or 1 major plus 2 minor or 3 minor. Okay, remember, very very important. Okay, exactly, staphylococcus is very right. Yes, remember, if first time I have been, what you called diagnosed with acute rheumatic fever, either what you call 2 major or 1 major and 2 minor. Okay, either 2 major or 1 major and 2 minor. Whereas if I have been diagnosed with rheumatic fever, again I got a second episode, then how many criteria should be positive? 2 major or 1 major plus 2 minor, or no major, 3 minor are positive. Done. That is the first point. Okay, this is very very important. This only is the first PG question. How many major, how many minor criteria should be positive? Okay, done. Next, essential criteria. See, now we know what is the major criteria. Now we know what is the minor criteria. We also have the essential criteria in a case of what, rheumatic fever. Anyone? What is the essential criteria do we have? Yes, exactly. Hanji, no problem, no problem. Staphylococcus. At least you are participating. The more you participate, the more you have chances to clear the exam. It's as simple as that. So what happens in essential criteria? Number one, I should have a previous evidence of group A beta hemolytic streptococci infection. I should have a previous episodes or previous evidence of group A beta hemolytic streptococci infection. Yes, exactly. And also at the same time, my ASO titer, the basal ASO titer of 50 units per deciliter, which goes up to 250. The ASO titer, which was 50, which is now going up to 250, is indicative of recent streptococcal infection. So in essential criteria, we need to understand the recent streptococcal infection. Okay, that's just one very importantly thing we should know. So we have major criteria, we have minor criteria, we have essential criteria. In essential criteria, there should be a recent evidence of group A beta hemolytic streptococcal infection, where I will understand it by seeing the rising of the titer. The ASO titer, which was 50, it can go up to 250 also, indicating of recent infection. Now, yes, now very, very good points. Carditis. The first point of the major criteria was carditis. Before we used to say pancarditis, now it is just carditis. Itis means inflammation, card means heart, inflammation of the heart. Most importantly, PG entrance question number one. Carditis basically occurs in how many percent of patient? What do you think? Okay. Hmm. Yes, dear. Yesterday homework, remember pancake, which I told you that was nothing but raising milestone, which basically comes by 5 months. In the yesterday's homework, I told you a milestone like this. This milestone I told you. Mm, like that. this this is known as raising milestone. It comes by 5 months. Okay, dear. So now coming back to the acute rheumatic fever, carditis occurs in anyone. Carditis open in, it opens in 90% of patients. 90% of patients. Okay, Osama says sir group A भी तो कर सकता है sir, can this yes, yes, it can lead to, but very less likely. Remember, it occurs number one. See, number one, carditis. Carditis occurs in 90% of patients, and most importantly, indolent carditis could be a late feature. What is the see? Remember, carditis is an early feature. Indolent carditis could be a late feature. What is indolent? Indolent matlab asymptomatic. Asymptomatic carditis. Like you get the features of carditis, but asymptomatic features. Okay. So number one, which is the early manifestation in the rheumatic fever? Carditis. How much it is common? Very, very common. 90% patient will have carditis, that you should know. And some can have indolent carditis also, like asymptomatic carditis. And then most importantly, 80% will have features of carditis within first 2 weeks of fever. With I told you, right, on the 1st of March I got fever, and 15th March I came to you with murmur in my heart. That's what. Within first 2 weeks of fever, I will have carditis. I will have features of carditis. Okay. Next, very important. See, it could be pericarditis, endocarditis, or myocarditis, right? If I'm having pericarditis, you know that, right? Like we have the covering of the heart. Yes or no? Yeah, very good. So we have the pericardium, then we have the endocardium, and then we have the myocardium. So myo is the muscle. So pericarditis. If I'm having pericarditis, I will have a precordial pain. First point. And what will you find in my auscultation? You will, in my auscultation, you will find the frictional rub, like a friction rub. What is friction rub? I will take a class on the RS examination. There I'll tell you what is friction rub. Right now, remember, in the acute rheumatic fever, in the carditis we have pericarditis. Patient will have a precordium. What is precordium? What is precordial pain? What is precordium? Anyone, if anyone has taken my the CVS examination classes, anterior chest wall, anterior chest wall overlying the heart, anterior chest wall overlying the heart, that is known as precordium. Anterior chest wall overlying the heart, that is nothing but what we called वो क्या बोलते हैं, precordium. Okay, 1 second. Staphylococcus says फिर से आ गया है ये उसकी. Okay, fine, समझ में आ गया. Okay, we have pericarditis. Then the pericarditis patient will have precordial pain, and most importantly, on auscultation you'll have friction rub. And then endocarditis, anyone, if I'm having endocarditis, what all features you will see? Will I have chest pain? Like in endocarditis, what all features will I be? You will see in mine. Anyone? In endocarditis, you will have a pansystolic murmur of the mitral regurgitation. Again, PG entrance question number one. What is the most commonest valve involved? The answer is mitral valve is the one which involves very, very commonly. Okay. Let's revise again. What are we studying? Acute rheumatic fever. In the acute rheumatic fever, what is the name of the criteria? The name of the criteria is modified Jones criteria. We have major criteria and minor criteria. Is carditis a major criteria or minor criteria? Carditis is the major criteria. Is this early manifestation or is it the late feature? It is the very early manifestation. Around 90% patient, 90% patient में जो है carditis होता है, and could be pericarditis, could be endocarditis. If it is pericarditis, it will be a precordial pain. If it is an endocarditis, it will be a murmur, pansystolic murmur. Okay, and most importantly, yes, again that was the exam question. In carditis, which heart valve is always involved? That is nothing but our mitral valve. Our mitral valve is always involved. Star mark, exam question. Every time I put a star mark, it's a exam question. Very good, Pancake. Very good, Raghuvansh. Very good, Staphylococcus. Very good, very good. So that's how you have to answer, okay? Next question. So you get a mitral regurgitation murmur is what you will get, right? Pansystolic murmur. Very good. So carditis over. Now arthritis. Very important. Very nice. Arthritis. Now who will tell me? Like now question number one. What is arthritis? What is arthralgia? We all know that arthritis is nothing but inflammation of joint. Yes or no? And arthritis is nothing but joint pain. Just joint pain is nothing but arthralgia. And arthritis, you will have same, the local rise of temperature, pain, stiffness of joints, inflammation, all those things, right? Yes. क्या पन्ना अच्छा ठीक है. Fine, very good. So arthritis, my question is most importantly, is it a large joint involvement arthritis, or is it a small joint involvement? Who will tell me now? Is it the large joint are involved, or is it the small joint are involved? Can we have a very important MCQ question here? If the large joint is involved, what is my diagnosis? If the small joints are involved, what is my diagnosis? Who will tell me? Very good. So if the large joint are involved is nothing but acute rheumatic fever. In acute rheumatic fever, large joints are involved. Very good, very good. You guys are doing so good. And if small joints are involved, anyone, if small joints are involved, which disease I'm suffering from? Can we name any disease where small joints are involved? I am having early morning stiffness of joint. Have you heard of swan neck deformity of the small joints? Have you heard of buttonhole deformity of the small joints? Which condition do you see small joint involvement and swan neck and buttonhole deformity? Yes, very good. Anyone? Yes, you have rheumatoid arthritis. Very good. The best answer is rheumatoid arthritis. Yes or no? You need to open your brains, okay? It is, don't cram. Understand. Patient will have arthritis. Arthritis, large joint or a small joint? Large joint, you will think of acute rheumatic fever. Small joint, you will think of rheumatoid arthritis. And again, very importantly, arthritis, is it a monoarthritis? Is it a oligoarthritis or polyarthritis? Yes or no? That also it differentiate. Our differential diagnosis changes. If it is just, can anyone what is monoarthritis? If only one joint. If only one joint is involved, it is monoarthritis. Can anyone name me one example of monoarthritis? Is acute rheumatic fever an example of monoarthritis? Or what is the example of monoarthritis? You need to open your brains, okay? You need to open your brains. Very good. So my question is, see, we have monoarthritis, right? And we have polyarthritis. So any one differential diagnosis of each? Polyarthritis, of course, the example is acute rheumatic fever. We all know that the arthritis in acute rheumatic fever, number one, it is migratory. Yes or no? Migratory. It is the fleeting type of arthritis. वो क्या होता है? What is the meaning, sir? Means, dear, that right now my right elbow joint swelling is there and very painful. Right elbow joint swelling. After 2 days, this swelling subside by itself. Now I'm having my left knee joint swelling. Are you understanding? So migratory. 2 दिन यहाँ दर्द था, अब 2 दिन I have a swelling and pain in the left knee joint. After 3 days I'm having swelling and pain in my left wrist joint. So migratory. Poly. Poly means more than 4 joints involvements, right? And what is mono means single joint involved. I ask you, what is the example of monoarthritis? Can we think of septic arthritis? Yes or no? Can we think of septic arthritis? Can we think of tubercular arthritis? So septic arthritis, tubercular arthritis, these are the examples of monoarthritis. Are you understanding? Yes or no? Are we understanding this much? It's a very beautiful topic, very simple, very nicely we are covering. Are we understanding this much? Yes or yes. What do you think? समझ में आ गया? चलो, very good. Yes, very true. Septic arthritis, tubercular arthritis, TB spine, these all are monoarthritis examples. Very good. So most importantly, arthritis, number one, more than 4 joints are involved. Large joint or small joint in acute rheumatic fever, it is the large joint, right? Very good. And also at the same time, and we need to know, could be involving the knees or ankles or elbow, right? Yes or no? Very good. Also at the same time, we need to know it is large migratory polyarthritis, large migratory polyarthritis, right? Very good, perfect. Then what happens is arthritis a early manifestation or late manifestation? Who will tell me? Is arthritis an early manifestation or the late? This is the exam. These are exam questions. Okay, these are the PG entrance question. Which of the following is an early manifestation? All are early manifestation except, like that they ask the question. This is the, my dear pancake. It is the early manifestation. Remember, chartered accountant. Okay, carditis, arthritis, erythema marginatum. These are the early manifestations, pancake. Okay, remember that. Very good. Next question. And most importantly, there is no residual deformity. Very important. In a case like if I'm having pain and swelling in my right elbow joint after 5 days, if I'm having pain and swelling in my right knee joint, then the joint which has gone, the swelling which has gone, there is no residual deformity. There is no residual deformity. Remember that. Okay, very good. Then coming the subcutaneous nodule. So what all we covered? We covered carditis, we covered arthritis, like carditis, arthritis, and now we are covering the subcutaneous nodules. Subcutaneous nodules. Question number one: are they painless or are they painful? Now, who will tell me? Are they painless or are they painful? And what are the location? Where are they located? See, photographic memory is everything in life. You look at the picture and tell the diagnosis. You look at the picture and tell the diagnosis. Most importantly, yes, they are very good. They are nothing but they are painless. They are nothing but they are painless. That is the first point. Second most important point is they are located over the bones. They are located over the bones. They are located over the bones. Like most importantly, over the over the olecranon process. This one very importantly, like this one, over the olecranon process. Over the olecranon process, they are located over the spine. Can we see that this whole thing over the spine they are located? Yeah, very good. Over the bony prominence, that's very important. So subcutaneous nodules, number one, it is a late feature. That's also another question. It's a late feature. Tender or non-tender? They are usually non-tender, and they are usually on the spine, on the chin, on the elbow, on the shin. On the spine, okay, on the chin, on the elbows, and on the shin bones also, down part also. Okay, that these are things you should know. Very good, pancake. And also at the same time, the size of the, what you called, what is the size of these things? Any random guesses? What are the size of this one? This one, the bony prominences, the subcutaneous nodules? Are they what you call big size, small size? They are usually pinhead to almond size. They are usually pinhead to almond. Almond खाते हैं बादाम दिमाग तेज करने के लिए, तो सब में बहुत ज़्यादा है. So they are usually pinhead to almond size. ठीक है? Very good. That is the first point. Second important point is patient who have this is a very important point. Patient who have subcutaneous nodules almost always have carditis. Star mark. Very important question. Patient who have, anyone? This is a good question. Patient who have subcutaneous nodules almost always have carditis. Please, this is important. This is very important. Very important. Yeah. Yeah. Dorsal and it's rhyming. Okay, समझ में आ गया? Has everyone understood? I hope I'm able to get make you understand. Very good. Next important point. Yeah, I'll show you a video. You have to tell me the diagnosis. 1 second. Okay. Yes. What is the child doing? Very nice, important question. For this, I would like to thank Dr. Nitin. This my mom was there. She has kept heater there. That's why a little bit of movement. Yeah. Hmm. Very important video. Can anyone tell me what is this child doing? And I would like to thank Dr. Nitin for this, one of my dear favorite junior from South, and he has sent me this video. And what is this child doing? Is this normal? What is this? ये बच्चा कर क्या रहा है? Any random guesses? Is the child playing or having seizure or what? What is this? What is playing? Very good. This child is having chorea. This is known as chorea. Very importantly, this child is suffering from chorea. This child is having chorea. What is chorea? What is this? What is the child doing like this? ये pancake करती है घर में बैठ के. Pancake ऐसी करती है ना घर में टक 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 टक. So what is this? This is nothing but chorea means very important. In Greek, it is meaning dance like. In Greek, it's meaning dance like. They are rapid, chaotic movements that seem to flow from one body part to another. They are rapid, they are chaotic movements that seems to flow from one body part to another. Very, very, very important video based teaching. Please remember, this is the best way we can learn and share knowledge on this planet, by showing the real patients and by showing the real scenarios how you should look. एक होता है theory पढ़ना, एक होता है literally clinical oriented teaching. This is like a clinical case. Look at the video and tell the diagnosis. It's like that. Okay. Okay, you don't? Okay, fine, no problem. Then you show us how do you dance at your house. Okay. Now, very important, is chorea a late manifestation or is chorea a early manifestation? Who will tell me? Is chorea, is it a late manifestation or is it a early manifestation? What do you think? You need to answer me every single point. The more you answer, the more chances are there you'll clear this beautiful exam. Yes, it is one of the late feature. Very good, very nice. ठीक है. हाँ. प्रिया से सर ने कहा है तो मानना पड़ेगा. Healthy talks. Okay, healthy discussion, don't feel bad. All love each other. Okay. Now, most importantly, कब आता है this late feature? When does it come? 3 months after the onset of rheumatic fever. Remember, carditis, arthritis and erythema marginatum are the early manifestation. So subcutaneous nodules and syndrome chorea are the late manifestation. Chorea happens 3 months after the this one. Okay, very good pancake, very good staphylococcus, Priya, Raghuvansh, Mansi, Tanu, very good. Okay, I'm just having a good time. Next important point. Yes, what is this? What is this? Anyone? Any random guesses? Is this what is this? Palmer grass, pincer grass, or anything? Can you? I'll give you a toffee. Let me just give you a toffee. I will not eat this toffee. Okay, no, I will only give you. I can't take fat. Okay, I have a what do you call it? Pineapple flavored what do you call it? Candy, love candy. Oh, nice. I have a pineapple flavor love candy. I'll give to the person who will answer the best. Let me just show you the video. 1 second. Okay, I'm gonna play the video again. Now, what is this? Anyone? What is this? Okay, what is this? What is this baby showing to you? And at the same time, connecting with our what do you called acute rheumatic fever, what is the child doing? Can anyone tell me? Any one more guess? I'll show you once again. This one. He's Can we appreciate he's gripping my finger and losing my finger, gripping my finger and losing my finger. Again, I will, yeah, exactly. Who said answer? Yeah, who someone said the right answer. Yes, exactly. Priya. Priya has told the right answer. This is nothing but alternate. So, Priya, you get a toffee once we meet in Delhi. Once you get a rank one, and once we meet in Delhi, please take this from me. This is a love candy pineapple flavored. Okay, I'm keeping it safe for you. So this thing was nothing but can we understand appreciate some alternate squeezing and releasing of the finger? This is nothing but like a milking, like a दूध निकालते हैं ना, milking करते हैं भैंस को. So that's what milking position, nothing but known as milk maid grip. Very beautiful video, guys. Very beautiful video. Please remember this, dear everyone. Very nice video. So this is nothing but ये दूध निकालना. खींचो छोड़ो, खींचो छोड़ो, खींचो छोड़ो, like that. Okay. So milk maid grip. कितने लोगों ने रियल लाइफ में दूध निकाला है? How many real people among you have गाय का दूध किसने निकाला, भैंस का? Anyone? किसने सच में निकाला, किसने भैंस का दूध? पैनकेक ने भैंस की लाइन लगा दी है लिटरली. हाँ जी ओसामा, आपने निकाला है? किसी ने भैंस का दूध निकाला? मैंने निकाला है. मैंने अपनी लाइफ में, मेरे मामा के पास 2 गायें हैं. एंड माय मामा स्टेज इन यूपी. एंड उनकी 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 गाय का नाम है मनोरमा. मनोरमा इज़ माय काउज नेम. मनोरमा, तो उसका हमने दूध निकाला है करके गाय का. तो एनीवन, किसने निकाला है गाय का या भैंस का दूध? एनीवन? ओसामा, तुमने निकाला है क्या? अच्छा, ओसामा ने निकाला है. वेरी गुड ब्रो, मैंने भी निकाला है. प्रिया, पैनकेक. व्हाट अबाउट यू रघुवंश? भैंस का दूध निकाला है, गाय का किसका निकाला है बताओ? ओके, एनीवन एनीवन एनीवन? स्टेफिलोकोकस निकाला नहीं निकाला? सर, हाउ डू यू नो माय रियल नेम? ओके. नो व्हाट टू डू, आई नो योर नेम नाउ. ओके. दीप्ति. अच्छा. दीप्ति से बस भैंस का दूध पिया है, अभी निकाला नहीं है. ओके, दैट्स क्यूट. हाँ, please don't tell. अच्छा ठीक है, understood. So that's what. So exactly. So remember Manorma. Okay. So this one. Uh, मुझे हंसी ज्यादा आती है पढ़ाते टाइम, ये देखो बातें. Okay, so remember Manorma that most importantly cow's milk. Okay, so the way we take the milk, can we appreciate this video again? Last time, photographic memory is everything in life. Look at the picture and tell the diagnosis. So this kind of like लगता है pencil grasp है, but can we appreciate closely that the baby is gripping and releasing, gripping and releasing. This is nothing but, very importantly, nothing but alternate squeezing and releasing of fingers, something about a milking position, and known as milk made grip. Okay, okay, pancake, milk made grip. And this is nothing but like a choreoform movements. It's like a choreoform movements, nothing but seen in rheumatic fever. सिद्धांत ने निकाला है भैंस का दूध, बहुत अच्छी बात है. I'll give you a chocolate if anyone can tell me. Each 100 ml of cow's milk contains how many kilocalories, how many proteins, and how much gram of lactose? Who will tell me? Anyone? Each 100 ml of what you call cow's milk contains how many kilocalories, how much proteins, and how much lactose? And each 100 ml of breast milk contains how many kilocalories and how much what you called proteins and lactose? Who will tell me? ठीक है, हाँ जी, एनीवन एनीवन. पैनकेक, प्रिया, मैं नहीं बताऊंगा. दीप्ति, व्हाट डू यू थिंक? तनु, रघुवंश, रघुवंश मनी त्रिपाठी फ्रॉम चित्तौड़गढ़, व्हाट डू यू थिंक? आंसर बताओ, मैं नहीं बताना आंसर. आई विल नॉट टेल यू द आंसर डूड, इट्स इंपॉर्टेंट क्वेश्चन, यू नीड टू टेल मी दैट. या पैनकेक इज राइट. Each 100 ml of breast milk contains 65 kilocalories. Each 100 ml of cow's milk contains 67 kilocalories. Each 100 ml of breast milk contains 1.1 gram of protein, whereas each 100 ml of cow's milk contains 3.1 gram of protein. Each 100 ml of breast milk contains 7.4 gram of lactose, and opposite of 7.4 is 4.7. Each 100 ml of cow's milk contains 4.7 gram of lactose. This is a very good important topic, guys. We are, every single word which we are reading is very crucial and very important, without fail, without fail. Okay. Chalo, very good, perfect. Right, let's move further. So that's it. So nothing but the chorea patient, basically they will have deranged speech, they will be emotionally disturbed. So deranged speech, emotionally disturbed, and most importantly, it is very common in pancake. Remember that way, it is very common in pancake again. So remember pancake, right? In the girls, basically, number one, this mitral wall involvement is very common, chorea is very common, and again in savan, aortic, in our savan, aortic involvement is very common. Okay, savan is a boy in our group and his aortic involvement is very common, that way remember that. Next, very importantly, yes, it is a self-limiting course of 2 to 6 weeks. It is a self-limiting course of 2 to 6 weeks. OP guy says, so roughly by 2.5 months, OP guy 3 3 6, so 6 weeks, मतलब कितने हो गए? 1.5 महीना. Yeah. So OP guy says by 1.5 month, it'll be resolved by itself. Whereas Park Cardiology says 6 to 7 months it will resolve by itself. So both you should know. Yes, Osama is right, Raghuvansh is right, Vaidahi is right. Very good. Pancake, Tanu, very good. कब तक ठीक होगा ये कोरिया? Around 1.5 month in OP guy and 6 to 7 months in Park. Next important point. Yeah, this is a very good question. Again, let me open one more toffee. I have, which one I have? Yeah, in my classes usually I gave eclairs. So I have a eclairs with me. What is the drug of choice of Korea? Who will tell me that? Anyone? Yes. What is the drug of choice, guys? Who will tell me? Who will tell me? Will get a toffee. Who will tell me that? Anyone? Any random guesses? The drug of choice in a case of diazepam staphylococcus says, dear, the drug of choice is nothing but phenobarbital. Phenobarbital is the drug of choice in a case of our chorea. Number one, treatment of rheumatic fever will be penicillin, but chorea drug of choice will be phenobarbital. The drug of choice will be phenobarbital. Second drug of choice will be haloperidol. Okay, so first drug of choice is phenobarbital, and second drug of choice is haloperidol. That is one thing. Next, I'll give you two toffees if anyone can tell me. I'll give you a Ferrero Rocher. What are the, अच्छा ये तो आसान है वैसे, what are the other two conditions where phenobarbital is the drug of choice? I think ये तो this तो everyone knows I guess. Yes, ओसामा, नो प्रॉब्लम ब्रदर, तूने आंसर किया मेरे भाई, तू बहुत आगे चला जाएगा, बहुत आगे जा रहा है, तू टेंशन ना ले, तू आंसर दबा के आंसर कर, यू आंसर नाइसली, ओके, डोंट वरी, रॉन्ग राइट डजंट मैटर, आंसर 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 आंसर। नंबर वन, नींद कम आएगी क्लास में, नंबर टू, पार्टिसिपेशन ज़्यादा होगा, नंबर थ्री, इंटरेक्शन होगा तो याद ज़्यादा रहेगा, और वही हमारा टारगेट है, ठीक है ना। हाँ जी, पैनकेक, या हाँ जी, व्हाट इज द ड्रग ऑफ, यस एग्जैक्टली, इन न्यूनेटल सीजर्स ऑल्सो the drug of choice is phenobarbital. And anyone, any one more condition, वो भी पढ़ा है हुआ, staphylococcus, any one more condition dude, हमने पढ़ा है ये in my, if you're a newcomer please watch the previous videos, 60-70 videos I have recorded and it's amazing, and every video is very good. Gilbert syndrome, no, the answer is Crigler-Najjar syndrome. Very good, Osama is little near. Crigler-Najjar syndrome type 2. Crigler-Najjar, have you heard of Crigler-Najjar syndrome? Crigler-Najjar syndrome is of two types, type 1 and type 2. C for Crigler-Najjar syndrome, C for cancelled UGT enzyme. Cancelled UGT enzyme. We all know that unconjugate bilirubin gets converted into conjugate bilirubin with the help of uridyl glucuronide transfer enzyme. Yes or no? Have you heard of UGT enzyme? Yes. The unconjugate bilirubin gets converted into conjugate bilirubin with the help of UGT enzyme. So in Crigler-Najjar syndrome type 1, basically, C for Crigler-Najjar, C for cancelled UGT enzyme. Cancelled UGT matlab total deficient of the UGT enzyme, and that will lead to unconjugated hyperbilirubinemia, because if there is deficiency of uridyl glucuronide transferase enzyme, then unconjugate bilirubin will not able to get converted into conjugate bilirubin, leads to unconjugated hyperbilirubinemia. That is type 1 Crigler-Najjar. In Crigler-Najjar syndrome type 2, there is 10 to 20% activity of the UGT enzyme. Enzyme is still little present, 10 to 20% of activity. And to increase that activity, the drug of choice is phenobarbital. The drug of choice is phenobarbital. Has everyone understood this much? Yes or yes? Tell me, इतना बताओ पहले। समझ में आ गया सबको? वेरी गुड। पैनकेक समझ में आ गया? ओसामा समझ में आ गया? आगे बढ़े हम? तनु? ओके चलो, आई एज्यूम दैट एवरीवन नोज, लेट्स मूव फर्दर। हाँ जी, next important point. Okay, what, okay, the same question, where else you will give phenobarbital? The answer is neonatal seizure and Crigler-Najjar syndrome type 2. Okay, how it affects brain, I'll tell you. And most importantly, next, let's just finish this first, something now known as erythema marginatum. So what all we covered? Number one, yes, thank you Osama bro, and thank you Pancake. So we covered carditis, polyarthritis, subcutaneous nodule, chorea. Now is erythema marginatum. Number one, erythema marginatum. This carditis, arthritis. Yeah, erythema marginatum. Number one, erythema marginatum. Is it a late manifestation or a early manifestation? Who will tell me that? Is there's staphylococcus? Yeah, is erythema marginatum a early manifestation or a late manifestation? That is the first question. Yes, it is a E for erythema, E for it is the early manifestation. Very beautiful picture. Very beautiful pictures of erythema marginatum. How does it look like, sir? Most importantly, number one, it's an early feature. They are mainly on the trunk. PG entrance question number one, erythema marginatum is usually on the trunk. That is the first important point we must understand. Okay. Next, can we appreciate red spot with pale center? Very nice. Can we see that? This one, dear, this one. Can we see red spot with pale center? The center is basically pale. Can we see that? Everything center is very pale. And red spot, yes or no? Exactly. Right? So red spot with pale center. And increasing in size to coalesce with other adjacent spot. Slowly, erythema marginatum increases in size and it joins with the other spots also. Okay. Next, they are literally serpiginous outline. They form a what is serpinguous or serpiginous, like a snake. Like a snake. They are basically, the outline is like a snake, and that is known as, yeah, I also love wine. I love red wine. Red wine is my favorite. I love red wine. So they form a serpiginous outline, and serpiginous means snake-like, like creeping from one place to another. That is known as snake-like. Okay, done. Very good. Yeah, port wine stain, usually, not port wine stain, port wine. I like Shiraz. I like Shiraz, or even Great Banyan is also very nice. The normal Sula also is very nice. It all depends. Yeah. Next, this is a good question. Now, PG entrance question number 17. In acute rheumatic fever, which organ gets permanently damaged? Now, this is the good question. Hmm. I think wine and pizza is a good option. Pasta is nice, bro, but I love pizza. I like pizza. Okay, who like this one? Pizza. Which pizza do you like? Like, do you like pizza of Pizza Hut, or someone like pizza of Domino's Pizza you like, or any other brand? Do you know which pizza you guys think it's better? Anyone? Staphylococcus. Which pizza do you like? Uh, Jameson. I don't think so. I don't think so. I've tried Jameson. It must be expensive, I guess. Hmm. So Pizza Hut, okay. Priya says Pizza Hut. Osama Pizza Hut. Pancake Domino's. Okay. Anyone? Any other options? Pizza Hut or Domino's? Domino's. यूनो. अच्छा, यूनो भी होता है क्या? भगवान जाने भैया कहाँ कहाँ चीज़ें होती हैं, बस बहुत कुछ पता है. यूनो. ओके, आई हैव नो आइडिया. आई हैव नॉट हैड यूनो पिज्ज़ा. ओ ओवन स्टोरी. अच्छा, ओके. ओवन स्टोरी भी होता है. गाइस आर वेरी हाई फाई. दैट्स गुड. या आई एम नॉट दैट हाई फाई. ओवन स्टोरी. अच्छा, और भी नए नए नाम आ गए. बहुत बढ़िया भाई. वहां तक तो मैं कभी गया ही नहीं. मैं तो पिज्जा हट और डोमिनोज खा के खुश हो जाता हूँ. बट माई फेवरेट इज पिज्जा. नंबर वन. वाई? बिकॉज पिज्जा हट, दे हैव अ डाइनिंग एरिया. Domino's have never a dining area. Pizza Hut, you can have tomato soup, and then you have an ice cream. You can have pizza also, pasta also. You can sit and nicely have a 1 hour and talk to your friends. So Pizza Hut has a good dining and a good heavy crust. I love eating heavy. Domino's is also nice. It has a thin crust, of course. It's more tasty, but Pizza Hut is nice. Pizza is good. Okay, nuclear brief. We have a ID. His name is Nuclear Briefcase. My goodness, such a amazing ID. Nuclear Briefcase. मतलब प्राइम मिनिस्टर सुन ले तो चक्कर खा के गिर जाए. क्या नाम है? न्यूक्लियर ब्रीफ केस. ही सेज आई कांट टेक वाइन, एलर्जी टू अल्कोहल. माई condolences. Very sad to hear that. Okay, हाँ जी. You have tried Jameson? Okay, I have not tried Jameson. हाँ. 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 अच्छा, डोमिनोज का वो बहुत अच्छा है ना, चीज बर्स्ट, उसी का आता है ना. कल मेरी नाइट ड्यूटी है. अच्छे से मुझे याद है. टुमारो आई विल ऑर्डर चीज बर्स्ट पिज्जा. डाउटेडली चीज बर्स्ट आई ऑर्डर. आई हर्ड इट्स राइट. Yeah. Okay. So the organ which gets permanently damaged is nothing our heart. Okay. This is the organ which gets permanently damaged. That is another exam question. Which one heal without a residue? Which organ heal without a residue? Our arthritis, even chorea manifestation, even features of pericarditis also. This pericardial rub and everything. They all get heal without a residue. That is one more point you need to know. Okay. Next, very important. Yeah, this is the good one. What about the lab results? I'm having carditis, polyarthritis, erythema marginatum, subcutaneous nodules, syndrome choreas, everything I have. Now, what about the lab results? Which blood sample you will take of mine in a case of acute rheumatic fever? Now, very importantly, you will take my TLC. Number one, I will have a little high TLC count because I'm having infection. No, I have fever, right? Yes, very good. You will take my TLC. Then very importantly, will I get my all acute phase reactants, ESR, CRP will be raised? Yes, ASO titer also very important. So number one, get my CBC done. What will you find? Sir, you have fever and all that, right? So you have all the features of acute phase problem. So CRP, ESR, high TLC will be there. And what's the treatment? Of course, ASO titer also will be there. What do you call it? What about what's the treatment of acute rheumatic fever? Most importantly, bed rest. That is the first treatment. Why anyone? Why? Now see, we are coming to the end of this topic. Yeah, blood culture, we don't do much in a case because it's not a gold standard investigation of choice. In my ICU setups also, if we get a patients of acute rheumatic fever, we don't send blood culture. Usually we don't send blood culture. Anji, this one. Okay. Why bed rest? Every single question is important, guys. 5 more minutes and this class is over. Why bed rest is important? Because dear patient is having features of carditis, right? The patient can land up into failure. He can have pericarditis, endocarditis, and myocarditis. Endocarditis, if he's having, he'll have a pansystolic murmur of mitral regurgitation. And pericarditis, he'll have a pericardial rub, friction rub. So, to avoid the features of carditis, rest is very important. Otherwise, the patient will go into failure. Next, yes, we all know that single injection of benzathine penicillin intramuscular. Okay, that is the first treatment we give, single muscular injection of benzathine penicillin. Any alternative do we have? I am allergic to penicillin. I am very allergic to penicillin. Or I'm having acute rheumatic fever. Can you give me anything else? Yes or no? Is this is the one only option available, or can you give me anything else? If I am allergic, then you can give me penicillin V also. See, injection if you want to give benzathine penicillin intramuscular. Oral, if you want to give me, you can give me penicillin V 250 mg 4 times a day for 10 days. 250 mg TDS for 10 days. Okay, 250 mg TDS for 10 days. Other alternative will be very importantly nothing but, as you have already said, erythromycin. Erythromycin, you give me 250 mg QID. QID is 4 times a day. You know, right? You know that, right? OD is once a day. PD is twice a day. TDS is thrice a day. QID is 4 times a day. That's how we write. एक गोली सुबह खानी है, एक गोली रात को खानी है, दोपहर को गोली नहीं खानी, like that. Okay, so OD, BD, TDS, and QID. If I'm allergic to penicillin, you're giving me oral erythromycin. Please give me 250 mg QID. But if you want to give me oral penicillin, give me 250 mg. Again, not TDS, I would say again 4 times. This also QID, this also QID, and this also erythromycin also QID. Very good. Yeah, bis in die. That's true. That's the Greek meaning. Suppressive therapy. This was the main first therapy. In the suppressive therapy, you'll give me aspirin or corticosteroid. See, the patient have a lot of pain. Okay, very painful. I have seen children crying because of this such a migratory arthritis pain, right? Yes. So aspirin or corticosteroids you can give me for how long? Anyone? For how long should I give you? You'll give me for 6 months? You'll give me for 1 year? You'll give me for 10 days? For how long? Anyone? For how long will you give me this, what you called, yeah, exactly. So for how long will you give me the aspirin or corticosteroids? The answer is for 12 weeks. For 12 weeks. Okay, that is the one thing. What is the duration of treatment for what is the duration of treatment for first episode of nephrotic syndrome? I have a first episode of nephrotic syndrome. We're gonna start renal also very soon. I have a first episode of nephrotic syndrome. What is the drug of choice in nephrotic syndrome? We have to understand. Pancake says lifelong. No, Pancake, we don't give lifelong prednisolone to the patient. I have nephrotic syndrome. This is my first episode. What is the drug of choice? It is a very simple question. What is the drug of choice? The drug of choice is nothing but prednisolone. That is the first point. What is the dose? What is the dose of prednisolone? The answer is 2 mg per kg per day. 2 mg per kg per day for 6 weeks, followed by 1.5 mg per kg per day alternate day for next 6 weeks. This is the treatment for prednisolone. Please remember, prednisolone you can give either by mg per kg per day or by BSA. What is BSA? Body surface area in milligram per meter square. So either, I'll repeat again. What is the drug of choice in nephrotic syndrome? Prednisolone. For how long to give? 12 weeks. How should you give? Sir, 2 mg per kg per day for 6 weeks, followed by 1.5 mg per kg per day for next 6 weeks. Total treatment is for 12 weeks. Okay, that is the first point. Same goes here also. Aspirin and corticosteroids also are given for 12 weeks. 12, 12. We have to link and study. That is why I'm jumping here and there. That is why I'm asking you. Okay, we have to link and study. And other than in the latest guidelines, other than 2 mg per kg per day, you can give me according to the body surface area also. You can give me according to the body surface area also. Done. Next one. What benefit I will get from the steroids? Why are you giving me corticosteroids? Most importantly, this pericardial friction rub tend to disappear within 3 to 5 days. Basically, my steroids are anti-inflammatory, so this pericardial friction rub tends to disappear within yeah, exactly, within nothing but what you called 3 to 5 days. Okay, pancakes. It says Google Pay screenshot. Why this? Why your Google Pay screenshot is there on your this one? Exactly. Good question. Untreated rheumatic fever subsides in dash week in dash percent of patients. PG entrance question. What will you write and come? Untreated rheumatic fever. Okay, I didn't give steroids, I didn't give this one what you call the benzathine penicillin, but untreated rheumatic fever, if it has to subside, then in how many weeks it will subside? The answer is usually in 12 weeks it subsides in 80% of patients. In 80% of patients, untreated rheumatic fever subsides in 12 weeks. In 12 weeks, okay, can never 100%, but in 80% of patient, untreated rheumatic fever subsides. Okay, that is one point. Next, yeah, same thing I have told you. If the patient have carditis, remember carditis, polyarthritis. If the patient has carditis with features of congestive cardiac failure features means nothing but like periorbital swelling. Yes or no? Have you heard about CCF features? Periorbital swelling, like facial puffiness, like you can say tender hepatomegaly. Yes or no? Like you can say ascites, like you can say effusion. So any patient with the features of carditis with congestive cardiac failure, what is the drug of choice? In that time, any heart problem, you will give me corticosteroids. Carditis with congestive cardiac failure, you will give corticosteroids. That is the first point. Carditis without congestive cardiac failure, you will give me steroids are better. Like steroids basically are better than aspirin. Okay, I'll repeat again. If there is carditis with CCF, give steroids. If there is carditis without CCF, then two options are there: steroids also or aspirin also, but steroids are better. And if there is no carditis, then give aspirin. 98 to 120 mg per kg per day for 10 weeks, then taper the dose for next 2 weeks. Okay, yeah. The drug of choice for CCF, the drug of choice for congestive cardiac failure is nothing but injection Lasix. Lasix is the brand name. The drug is furosemide. Furosemide. Okay, that you should. Then समझ में आ गया? So carditis with CCF, give corticosteroids. Carditis without CCF, give steroids or aspirin. And no carditis, then only aspirin. Okay, that's it. And steroids we give same, not like prednisolone, 2 mg per kg per day for 3 weeks, then taper in the next 9 weeks. Just remember the dose, 2 mg per kg per day. That's it. In nephrotic syndrome also, prednisolone is given at 2 mg per kg per day, but it was 6 and 6. It was given 2 mg per kg per day for 6 weeks, followed by alternate days 6 weeks at the rate of 1.5 mg per kg per day. This one is just 2 mg per kg per day. That you should know. Okay, very good. How can I prevent rheumatic fever? How can I prevent rheumatic fever in my further life? Most importantly, of course, it is divided into primary prevention and it is divided into secondary prevention. Okay, we have primary prevention and we have secondary prevention. What happens in primary prevention? In the primary prevention, of course, you identify, first of all, you identify a streptococcal sore throat infection. In the primary prevention, you identify a streptococcal sore throat infection and also educate the community about the rheumatic fever, how it will come, it can damage the heart, and this and that. And also, secondary prevention, you give drugs. Hygiene, yeah, but mostly, yeah, identify the infection and educate. In secondary prevention, good. I'm happy, Osama, you are trying to answer. Very good, bro. Answer. Karta hai, chhod mat. In secondary prevention, what will you give me? Now, this is exam question. You will give me benzathine penicillin. How much? Very, very, very important. Less than 30 kg baby, you will give me 6 lakh international units, and more than 30 kg baby, you will give double the dose, 12 lakh international units. Okay, very, very important. The prevention of rheumatic fever, secondary prevention, you will give me benzathine penicillin. Less than 30 kg 6 lakhs, more than 30 kg 12 lakhs. Very important. Okay, benzathine penicillin. How do you give? Do you give IV or do you give subcutaneous? Anyone? How do you give? What do you think? Staphylococcus having dinner. Okay, Osama, where are you appearing in this NEET 12th March? Okay, I'm appearing. You appearing? Okay, so it is given IV or subcutaneous? Yes, it is given IM, intramuscular. Yes, it is given intramuscular. Very good. Is this injection painful, anyone? Has anyone given कभी दिया तुमने किसी patient को injection ऐसे वाला? Has anyone given real patient acute rheumatic fever? Have you given real patient? Have you given a benzathine penicillin? Number one, this injection of this syringe, basically, if this is the injection, it's very milky. The content, the benzathine penicillin is like a whitish, white milky. And number one, बहुत जल्दी clot हो जाता है, ये घुसता नहीं है. You have to just give it very fast. Can't slowly give it. It is the needle gets blocked, and you have to change the needle again. Very importantly, this one, it is very painful. And when to give? It is given on the weekends. Always give injection on the weekends. Why? Anyone, why weekends? भाई मैं तो मंडे को दूंगा, कल तो मेरी क्लास है, मैं फ्री नहीं हूँ. I will give Monday night. What is any problem if I give on Monday night? Why this injection is only given in weekends, or preferable to give on weekends? Pancake, because to avoid school abstinence. पैनकेक जैसे बच्चे स्कूल भागते हैं, स्कूल से स्कूल ना जाते ही वो. सो टू अवॉइड पीपल लाइक पैनकेक वांट टू रन फ्रॉम स्कूल, that is why it's better to give the injection on the weekend, because in the morning she will jump and tell mummy it is very paining, I am not going to school, like that you will do. Okay. Yeah, so to avoid school abstinence, because the school, it's very painful, that's why. Okay. Next, very important, till how long to give the injection, that also very important. Someone was saying every 21 days. So how long to give the injection? Most importantly, patient without proven carditis should receive prophylaxis for 5 years after the last episode, or until they are 18 years old, whichever is longer. Yeah, Pancake says I used to do that when I was a kid. I hated school. I see, Pancake. So remember, dear, till how long could you give this injection? Number one, for 5 years. Like patient without proven carditis should receive the prophylaxis for 5 years, and after the last episode, and or until they are 18 years of age, whichever is later, whichever is later. And also, if I have a patient with proven carditis, I had a pericarditis, I had a pericardial pain and a friction rub, I had a endocarditis, I had a pansystolic murmur of mitral regurgitation. So patient with proven carditis should receive the prophylaxis for 10 years after the last episode, and until they are 25, whichever is later. So remember, very importantly, 5 once again, yeah, 5 and 18, and very important, 10 and 25. These four words in your flow chart should be there. With proven carditis, without proven carditis, give for 5 years, and or till I am 18 years old. And with proven carditis, give for 10 years, and what you call until they are 25 years old. Okay. Yeah, same like ROP. 34, no, 32, no, ROP is 32. It was 32 weeks, 4 weeks postnatal age, that is one thing, or 32 weeks, whichever is later, not 34. Okay. And patient with established rheumatic heart disease following a valve surgery, what about them? I had rheumatic heart disease, I got a valve surgery also done, and now what about me? Should I take the prophylaxis every 21 days? What should I do for me? So for you, sir, yes, you will take lifelong prophylaxis, number one. And number two, very important, don't give after 40. Very importantly, why? Anyone, why the injection this every 21 days I'm talking and this and that? Why not after 40? Why these injections, benzathine, penicillins, IM, painful, this, that? Why they are not given after 40? Anyone? Why it is avoided after 40? Who will tell me? Because after 40, what happens? The likelihood of reoccurrence is very rare, very minimal. Okay. Yeah, the likelihood of reoccurrence is very minimal after 40. That's why lifelong means till 40 you'll give, not after 40. The recurrence level goes very down. Okay, that you should know. Okay, and yeah, or that's what you know, that in the secondary prevention, you can give me benzathine penicillin, less than 30 kg 6 lakh, more than 30 kg 12 lakhs, or you can give me penicillin V 250 mg orally BD. That's we have done. And if I'm allergic, then definitely give me what you call erythromycin. You give me erythromycin, that also you can give to me. And that's it. That finishes our wonderful topic of acute rheumatic fever. I hope you guys have understood something. हाँ जी, पैनकेक लो बैटरी हो गई है, क्लास का 1 घंटा भी हो गया है, अभी हमारे जाने का टाइम हो गया है. समझ में आया कुछ कुछ या नहीं आया? एवरीवन टेल मी frankly, did you understand something? Did we cover some important questions? Did we cover something knowledgeful today? So acute rheumatic fever is one of a very good long topic for medicine, for pediatrics, short note, long note, MBBS question, बहुत सारे क्वेश्चन आते हैं. And yeah, yes, इस टॉपिक का टेस्ट हम बाद में लेंगे डेफिनेटली. एंड टुमारो वी विल कंटिन्यू फर्दर. Tomorrow we have left with the coarctation of aorta. One few here and there topics we have left. Cardiology is almost coming to an end, so I'm planning to take a test tomorrow. Like what do you call it? A rapid test of the whole general pediatrics, including milestone and this and that. Let's change tomorrow and do something about it. And again, before leaving, again, we have this very important quote which has to be revised again. The quote says, पढ़ना बंद ना करें क्योंकि ज्ञान की कोई सीमा नहीं होती. पढ़ाई एक ऐसा इन्वेस्टमेंट है जो आपको लाइफ टाइम ही रहेगा. Once you finish your concepts nicely, once you update your notes nicely, not just the NEET PG, once you enter a beautiful platform of MD or MS, become a medicine, gynae, ophtha, PDO, pediatrics or anything like that, then these all things will help you. पढ़ाई एक ऐसा इन्वेस्टमेंट है जो आपको लाइफ टाइम रिटर्न देता है. Okay, that is one very important. Okay, and tomorrow, remember guys, what you called this one, we have tomorrow is my night duty. Okay, so tomorrow evening we don't have a class, we only have a class in the morning. If anyone is free in the morning, let me know. And tomorrow I'll take a rapid revision test of pediatrics, a mixed questions maybe I will take. Let me just check 1 second tomorrow what time we have the class. Tomorrow, कल क्या वार है और कल क्या दिन है? Tomorrow is 19th of January. 1 second. Yes, 19th of January, 9:30 a.m. 19th of January. Tomorrow is 19th. Yeah, exactly. So we have two classes we have. Tomorrow we have a class, special class. Tomorrow I'm writing it here once. If anyone is free can come comfortably. Tomorrow we have a class in the morning, 9:30 a.m. I'll be asking you little questions on coarctation of aorta plus a rapid test I will be taking of you of general pediatrics. And then we have a very important class at 1 p.m. 1 p.m. In that also I'll take a surprise test of the basic milestones and of the neonatology. So tomorrow we'll have two tests. This class will be a special class on the Unacademy app. Okay, and this one is a YouTube class. Right now we are taking on YouTube. So if you guys are free tomorrow 9:30 a.m. and afternoon 1 p.m. we will have the class. Thank you so much, everyone. Thank you so much for the wonderful evening. I hope you have learned something. I hope you have gained some amount of knowledge. And thank you. Thank you, Pancake. Thank you, Raghuvansh, Priya, Besant, Vedahi, Priya, Osama, Staphylococcus. बहुत मज़ा आया. अच्छे से करो. टॉपिक बहुत बड़ा था और अच्छे से हो गया. ठीक है, ख्याल रखो अपना. चलो, बाय 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 एवरीवन.